Good afternoon, everyone. I'm Sanprit Kaur, Head of Marketing at NestorBird. On behalf of NestorBird, I would like to thank you all for joining this zero license cost ERPNext Healthcare Software webinar. So we have our team with us who will be presenting an insight into ERPNext Healthcare Software webinar. So let me introduce Ms. Alka, Head of Growth and Acquisition, Ms. Sheena Singh, ERPNext Consultant, who will be sharing an insight into ERPNext Healthcare Software features, benefits, modules, and successful implementation of ERP software at RYK Hospital, Pakistan. So, Alka, over to you.
Thank you, Sanprit, for the introduction. I'm Alka Bansal, Head of Growth and Acquisition at NestorBird. I'm excited to brief you about the ERPNext, which is zero license cost ERPNext healthcare software solution. As you all know, that ERPNext is a centralized platform that helps us to streamline and automate various aspects for healthcare organizations. Whether you are managing patient registration, whether you are tracking inventory in your pharmacy, whether you are monitoring incentive care units. ERPNext is the best fit for healthcare organization. With features like analytics and reporting, billing and reminders, assets, accounting, HRMS, and payroll, ERPNext is the best choice for the healthcare to streamline the operations and manage the everything in healthcare operations. Thank you, Sanprit. All yours.
Yeah. Thank you, Alka, for sharing an insight into open source ERPNext healthcare software solution. So moving forward, we have Ms. Sheena Singh with us. She is ERPNext consultant and she'll be presenting live ERP demo of ERPNext healthcare solution. So over to you, Sheena.
Hi everyone, a very good afternoon to all. I'm Sheena, I'm an ERPNext consultant here at NestorBird, and today I'll be demonstrating the ERPNext Healthcare solution that we configured for RYK Hospital. Let me share my screen and let me know if it's visible. I hope my screen is visible now.
Yeah, it is visible.
All right, let's get started. So let me give you a brief about RYK Hospital. So RYK Hospital is one of the leading hospitals in Pakistan. They have a total capacity of 300 plus beds, 5 operating theaters, and they have over 500 employees, and they have served about 25,000 customers so far. So when they came to us, they were having a lot of trouble with their healthcare management system, partly because of a couple of problems. All their appointment booking was manual. Their data was also not being handled properly, and they were having administrative challenges also, along with the fact that all of their workflows from OPD to IPD wasn't streamlined. So that was the problem statement that we were trying to tackle with RYK Hospital. So NestorBird came up with a solution for RYK. So NestorBird, let me give you a brief, is a Frappe certified company and the top ERPNext consultant company in the North India. We have implemented a lot of ERPNext solutions, and we also implemented for RYK hospitals. We looked at their problem statement and then we streamlined their IPD flow, OPD flow, along with lab test services. We wanted to help them to streamline their healthcare operations and improve overall productivity and performance. So we'll now go through the agenda for today's webinar. We'll be covering all the masters that are required in healthcare, along with the framework of ERPNext modules that support this healthcare domain. Then we will go forward and go through outpatient and inpatient flows. Uh, Along with that, the next on the agenda will be laboratory management. And in the last, we'll cover all the reports that are related to healthcare. So let's get started. Let me share the instance of ERPNext. So here you'll see what I was explaining, the masters. In this, the ERPNext Healthcare sits in the center of this domain. And these are the masters that support this ERPNext healthcare domain. Patient is somebody who needs healthcare services. Healthcare practitioner is someone who provides these healthcare services. Practitioner schedule is used to refer the schedule that a healthcare professional has. For example, when they will be available to provide these healthcare services. Along with medical standards and coding, some countries have specific standards for medical tagging of equipment as well as procedures, like the ICD-10 for USA. So ERPNext also supports these medical standards and codings. Medical department, it defines the medical department these services are provided for example, cardiology, gynecology, urology, etc. And healthcare service unit is service unit where the healthcare services are given or provided, for example, OPD rooms, ICUs, etc. So these are set on the bedrock of ERPNext core modules, which are selling, accounts, stocks, buying, projects, and assets. So these core modules support healthcare domain to do their efficient business processes. So let's dive into the instance now, where I will show you the masters I was talking about. So first, let's go through the patient master. So here you can see a list of all the patients. We'll open one of the patients to see what data is captured in the patient master. So here you can see these are the connections which will quickly take you to create a patient appointment, create vital signs for the patient, if there is some clinical procedure. So you can, so the best part about ERP is it is very interconnected, and you don't have to sift through a lot of pages to reach somewhere. In these connections, you can open billing for the patient. You can create an inpatient record for the patient. You can see patient demographics here, all the details. So MR number was a custom field that we made for RYK. CNIC was also their identification number. Here you can see, like I was telling you, the medical department, what is the status of the patient, who's the healthcare practitioner, what is the patient type, is it OPD, outpatient, or inpatient. All these details are captured on the patient master, along with first name, mobile number, if they are their email is available, do we want to invite them as a user in the ERP software, along with their address, other details. Like, so in ERPNext, in the healthcare settings, if we turn on the settings, let me just show you in a minute, that if we do link customer to patient, then the minute we create a patient, a customer is created in the backend for billing purposes. For this patient, we already have created a customer. Now you can see personal history, like what is their occupation, marital status, if they are related to an existing patient, then allergies and medications, if they have any allergies, some medical history, some risk factors, are they consuming some alcohol or tobacco or other risk factors. So this is your patient master. Then we go through the healthcare practitioner. It's similar. So for patient, we gather patient information. For healthcare practitioner, we gather doctor information. The connections are similar. Then you have their basic details, their full name, phone number, mobile number. Is there an employee in the HR payroll for this particular hospital? In the appointment, what practitioner schedule do they have? So for example, if they have a practitioner schedule, just give me a second. Okay, yeah. So this is the practitioner schedule. Here you can see Sunday. This doctor is available on Sundays also from 9 a.m. to 11:55 with 25-minute slot. So this is your practitioner schedule master to log down all the timings and the availabilities for a particular doctor. What are their consultation charges for IPD and OPD? Account details, address, contact. So these are all the healthcare practitioner details for the healthcare practitioner master. So once we have done that, then we move on to the healthcare service unit. Here you can see on the screen, before moving to the healthcare service unit, the medical departments which I was telling you about. So whatever medical departments your hospital caters to, These are a list of all the medical departments. As you can see, RYK has a lot of medical departments like ophthalmology for eyes, for cardiac surgery, for neurosurgery. And so we can configure as many healthcare departments as we want. Then healthcare service unit. So healthcare service unit, as I explained before, is the service unit where healthcare services are provided. Here you can see OPD rooms as the healthcare service unit. We can also view these in a tree because a healthcare service unit like OPD rooms in a hospital, there can be multiple OPD rooms. So in this tree structure, you can see Ward 1, Ward 2, Ward 4 and 3 are part of this OPD unit in RYK hospital. Then moving forward, we've covered most of the masters. Now we'll go to the OPD flow. So we've covered these masters. Now we'll move on to the outpatient flow. So a basic outpatient flow starts with that you have some ailments and you book an appointment. Post booking the appointment, you visit the hospital. At the hospital, they sign you in, they take your vitals to see excuse me, to assess your conditions. Post that you meet with the doctor. So meeting with the doctor is what in ERP we called an encounter. At that encounter level, we note down all the things like prescriptions and investigations that you need to do, some lab tests or some what are your symptoms, what are your diagnosis. And once the OPD, the encounter completes, then you bill the patient. I will replicate this flow and show you through ERPNext. So here you can see on their website, we configured this website for them. And once you click book an appointment, here you can click schedule an appointment. You write your name and you add your phone number, then select gender, some basic demographic details for booking an appointment. Then you select the department and then you select the healthcare practitioner. And then once you've selected all these details, you check for availability. Once you add the date, it will show up the calendar and availability of that particular doctor. And as you can see, 9:30 slot is not available for Dr. ABC. So we book a 10 a.m. slot. And once you do request for booking, the same appointment gets booked in the back end at the admin level. So let's see. Here you can see in the appointment list. Just give me a second. Just give me a second. Okay, so now you can see that the appointment I made from the front end, it's rallied back in the admin console, and you can see the healthcare practitioner is Dr. ABC and all the details have come in. So once the appointment is done, then we can directly from this connection, we can create a patient encounter. Like I was saying, a patient encounter is when the patient meets the doctor. And here you can see you can add all the symptoms from list of symptoms. Then you can define the diagnosis. If there's some medical coding, you can do medical coding. Then if you have to prescribe some drugs, you can go ahead and prescribe the drugs to the patient. If some lab tests are required, for example, a CBC panel or a dengue or all these other tests, you can assign these tests to that particular patient in this encounter. And if some procedures are required, some clinical procedures are, you can add all those things and press save. So we'll go through already created encounter to see how it looks like. So this patient had headache symptoms and the diagnosis was that it needs more investigation. So the doctor prescribes a CBC test. After that, once you have created the patient and the encounter is completed, then you can do all these tests which we'll cover in the lab test section. Once all the tests are done and the patient has visited and the encounter is completed, we create a sales invoice for this particular patient. So here you can see that this patient appointment is now closed because the patient encounter is created and the vital signs I was saying, like the vital signs are also noted down. These are the vital signs of the patient when they came in, like what's their heart rate, what is their respiratory rate, how is their tongue, what is their height, weight, and the BMI is already automatically calculated. So once you do that, you can create a sales invoice from the awesome bar. So ERPNext has this amazing feature again, the awesome bar. So you can search anything and it will take you to directly to where you want to go. So now we are at a sales invoice list. Here you can see that you can create a new sales invoice. Just a second. New sales invoice. Now it's asking for this patient. It's already fetched. And if there are other, like, so since in healthcare, the invoicing is not direct, but from a consultation healthcare services. So here you can see get items from, and you can fetch all the consultations that happen for this patient from here, from the service section, and it will be added in your item list. So let's go through an invoice which is already being created to understand how this happens. So for this patient, consultation OPD charges are already added, and this invoice is created. From here only you can create a payment entry, and if it's like on the spot payment, this payment entry will be created. If it's a QR code or something like that, it will be created automatically. So this was like the OPD flow, that the patient booked an appointment and came, and all the vital signs happened, and then counter happened. Now we'll go through the IPD flow. For the IPD flow, there can be two instances, that the patient comes in directly as an inpatient because it's an emergency, or the patient comes in through OPD and then it's transferred to IPD. Then the practitioner is assigned, the nursing unit is assigned. Then once the patient is admitted in the hospital, his treatment plan is also decided, all the medications are decided, and if the patient needs clinical procedures or something like that, all of that is decided. Then the patient is, if the patient has to be transferred, he's transferred from, let's say, ICU to a general ward. Once all the clinical procedures, investigations, lab tests, all of that is done, then the patient is discharged. And once the discharge happens, you can bill the patient in a similar way that we did for OPD. So let's go through this inpatient flow. So here you can see, for an emergency case, you can directly add an inpatient record. Here they will ask you patient, what is the admission date, time, what are the details, who will be the healthcare practitioner, what will be the medical department, what are the encounter impressions. So for OPD to IPD, these details will already be taken care in the encounter. But if it's like an emergency, we'll have to add these things, the medications, investigations, procedures, all these things. So then the inpatient record will be created. For example, I've already created for this patient. What are the details? Who will be the healthcare practitioner? What were the encounter expressions? Some medications, investigations like a CBC is ordered for this patient. If some procedures are ordered, so the inpatient record is created that way. In case I want to convert an OPD patient into an IPD patient, here you can see that this patient is an OPD patient right now, and you can schedule admission for this patient. So this means that I'm converting this patient who came for an OPD visit into an IPD. And here we select the service unit type, expected length of stay, and then we order the admission. And then once the patient is admitted, then we create an inpatient medication order. So we have, the patient has been admitted in the hospital. Now he needs some medications and medical help and services. So we create an inpatient medical order. So for example, this, you see that this is the inpatient medication order. Here, all the details are written, that this injection has to be given intravenously from this date at this time, and then again, these times are written down. Once this is done, the medications are given and the patient is healthy again and he has to be discharged. So all that, once every procedure is done and the patient is healthy, from here in the inpatient record only, here you can see that the clinical procedure also can be done on this patient. So this patient, the clinical procedure is already done. and one is shown here. And from this discharge, you can press discharge and the patient will be discharged. It will ask for the discharge reason and discharge date time, and we will discharge this patient. I'm so sorry, there's something. Let's continue. So the patient will be discharged and all the discharge reasons will be completed. So here we've discussed the outpatient flow and the inpatient flow, and the billing of this inpatient will be done in a similar way as it's done for OPD, where all the services will be fetched, all the lab tests will be fetched, all the clinical procedures will be fetched, and the patient will be billed that way. So the next on the agenda for today is laboratory management. So for laboratory management in the investigations, like we saw, that we can prescribe some lab tests. So before prescribing, as a setup, like we set up masters, we have to set up a lab test template. So lab test template will tell us what the test is about, what is its unit of measurement. For example, this test for your basic test for sugar, which is blood glucose random. We have to give the test name, and then correspondingly for the test, since it has to be billed in accounting, an item will be created. Then item group, what will be the department, and the result format can be multiple, like single, compound, descriptive, group, or no result. The description of the test, like blood glucose random, what is the unit of measurement, what is the normal range, what is the sample collection type, that you collect clotted blood. So this is required before we start with the lab test. So this is a template for a test. Once we are set in the template, then we create a lab test. So for example, for Hirsch, we've created this lab test for CBC. What is the company? So once the test reports are there, you can also send an SMS to this patient that your reports are in, like a standard laboratory procedure. Once your tests are done, you can send a report. So all the other details are also there. What's the patient name? What is the requesting practitioner? And who was the doctor assigned? Who was the technician assigned? So this is the lab test. This is all the list of lab tests with patients that were done. Let's then after the lab test is done, then there are lab test reports which I showed that can be sent to the patient. So this was all the laboratory management that we configured for RYK Hospital. Post which the last part of today's agenda will be reports. So we can cater to a lot of reports based on your requirements, but we set up these major 5 reports for RYK Hospital. These are account of daily inpatient, daily outpatient. I'll just walk you through them. So first of them is inpatient record, like how many patients are discharged, how many are admitted, and then how many discharges scheduled. This is for your IPD patients who have been admitted. Then then for OPD patient also, we have an OPD patient count. What is the total number of patient, total admitted patients? So this dashboard goes to your patient dashboard. And then we have just give me a second. The lab test. So the lab test report gives you a list of all the lab tests that are completed or invoiced, which are unbilled. So this is a list of all your lab tests. Then you have patient appointment analytics. So the appointments that you were booking in the OPD section. This is a whole analytics of that based on healthcare practitioners. For each healthcare practitioner, based on, you can make it quarterly, weekly, monthly. So for patient appointment analytics, you can see that we were discussing different type of reports. So this is another report for patient appointment analytics. So you can see the analytics based on medical department. For example, for which medical department, how many appointments have flowed in. For example, you can see for cardiology in October, there was just one appointment. Similarly, you can see it from healthcare practitioner also, for which healthcare practitioner how many reports were there. For example, this shows you a view in August. For this practitioner, there were one appointment. Similarly, for service unit bed occupancy, since we are handling occupancy and inpatient department, so here you can see which. So this is the service unit. For example, your female ward, the beds occupied are 8. So this is a graphical representation of the occupancy. Similarly, we can do it. Bed occupancy or based on department also, like medical department. Now we can see that the general medicine has 13 beds that are occupied for, and gynecology has 8 beds. So these are all the reports that are part of the healthcare module. We can also do more custom reports based on our requirements.
Hello everyone, I'm Hitendra. I'm working as a head of sales with NestorBird. So if you guys have any questions regarding the webinar, please feel free to ask me.
Hey, hi Hitendra, how are you?
I'm doing great. How about you?
I'm doing fine, thank you. Thanks for asking, and thanks for the session. It was very good and very informative, Sheena. So with regards to the, I actually posted in the chat also, like the integration with the health insurance providers. As you know that nowadays more and more people are opting for health insurance.
Right.
So I believe in case of both OP as well as IP, there will be like a copay, I believe like co-payment which they will be doing, which is like 10% or 20% depending on the plan.
Mhm.
So how does it work in terms of the billing? Will be like in terms of the invoicing point of view? One aspect is the integration with the provider. Like when it is submitted for approval, we need to know the status of the approval, whether it is approved or not. Will it be done off the system or within, it will be part of the like ERPNext itself? That is one thing. And the second thing, in terms of invoicing, for example, the entire invoicing is done to the customer, or like part of it is done to the customer where he will be only paying the copay and the rest to the insurance company.
Right. So thank you so much for asking your queries, first of all. So we can design the system both ways. Till the time the insurance providers APIs are available, it can be integrated. At the current moment, in most of the operating, hospital management systems, you have to go outside of the instance, and particularly on that insurance providers instance where you add all the patient details, their insurance card details, and what investigations have been done till today. So it can work it both ways. It totally depends what all insurance providers you want to integrate with, first of all. And if the APIs are available, we can design the system accordingly to accommodate both your queries over here. Firstly, when you are applying for the insurance approval, so you can directly submit all the details with the date stamps and all the reports available within the system of that particular patient directly to the insurance provider's portal. As soon as the approval comes in, so all the required department, not only the billing department but the admission as well, can be notified like the approval has already been done. Now thirdly, regarding the invoicing, so usually what happens whenever we are going with the insurance providers, they provide a particular package for each and every surgery or disease investigation they are providing. So again, depending upon the configuration of the application, we can set it up accordingly, where for every surgery or every service that the hospital is providing, whatever, again, depending upon the insurance company which has been selected, we can configure the pricing rules accordingly. So the patient would be charged, and if it's a co-payment, so the co-payment can also be distributed.
Okay, thank you so much. It's clear now. Thank you.
No worries. Anybody else? If you guys have any other questions for me, please feel free to ask.
So the next question we receive is, how soon can you implement ERPNext Healthcare Software in my hospital with 500 plus bed capacity and 500 plus patients visits every day?
So you want to implement both OPD and IPD?
Yeah, OPD.
So I think within 6 to 8 weeks of time, we can implement a complete end-to-end working ERPNext Healthcare with OPD and IPD for a 500 bed.
All right. Thanks for sharing your answer. So the next question we got is, how this ERPNext Healthcare solution different from other ERP healthcare solutions?
So the main and the basic, difference between other hospital management solutions in ERPNext is, first of all, ERPNext is an open source solution. You don't have to pay any kind of per user, per license cost associated with that. Being the open source gives us the freedom to customize it, or I would better, say it like a tailored implementation can be done based upon our requirement. As per my experience in this industry, whether same businesses or working in a same vertical, every business has their own best practices which needs to be replicated whenever you are implementing any kind of software in your organization. So ERPNext gives us that particular freedom. It's just a one-time implementation cost, and post-implementation, there are only two kind of cost comes to the client's way. First is the hosting cost. All the data in ERPNext is being saved in an encrypted manner, so there is no loss of data or any client patient's data. Along with that, post implementation, you can opt for an AMC that's completely optional and at the client's discretion to opt it for.
Okay. Thank you for sharing answer. So, guys, please ask your questions in the chat box. So the next question we got is, how can system cater healthcare checkup plans when the billing is done as a package and different tests and consolidation are created for different doctors?
So basically, whenever we are in, setting up the masters, so we can set up the masters as per the items of the plans associated with that. So as soon as the doctor is prescribing any kind of health checkups or any other kind of investigations to the patient at the billing counter, the billing person would be able, he would be able to view the associated pricing with that particular test or investigation the doctor has suggested for.
Okay. So guys, that's all for now. So thank you for your valuable time. If you have any question regarding ERPNext Healthcare Solution, its implementation, if you have any query regarding its features, benefits, modules, and the implementation process, so we'll be free to answer your call and we'll be free to give you demo. So please drop your query at sales@nestorBird.com, and you can also call us, SMS, send an SMS, WhatsApp at +919878990102. So we would be happy to assist you.
Thank you, everyone.